Okay, welcome everyone. This is going to be my lecture discussion on bones. So what I'm going to do is I'm going to post a video, one for the skull, one for the vertebrae, and the lower like sacrum coccyx, one for the thoracic bones, which are the ribs, sternum, one for the upper appendicular bones, arms, shoulder girdle, and then one for the lower appendicular bones, hip girdle, os coccybones, and the lower leg bones. So I'm going to start there first. So what I'm going to do, I'll give you a video explaining how to do this. We're going to do like a lab assignment through Blackboard where you're going to have to go in and identify some of the bones and then parts of the bone. So I'm going to go to our course. Here we are. Number 9. Here is the lab. Now I changed the page up a little bit. So the axial skeleton. So you're talking cranium, skull, vertebrae, and sternum. So here is our lab list. Now what I suggest you do is, if you're watching this video, either have this lab list open on some kind of device. If you want to print it out, that's fine too. I ran into this yesterday. Okay, let me try one more time. Maybe I'll need to be a little more patient. Let's wait for it to load really good. There. Okay, I went a little too fast. Gonna make this bigger. So bone is in capital letters, and then what you have underneath here are the parts, or what are called surface markings of a bone. You have the openings, which are foramens, excuse me, those. A fossa is a depression, and like process is a part of a bone, tubercles, trochanters. I will post you a sheet along with the skull bone document that kind of outlines what a condyle is, what a trochanter is, but you have to be able to identify the bone and know the parts of a bone. And I'll give you a practice run on that. So here's the list we're going to be using. Okay. So just to start first, we are going to do the skull. So here is, a little overall view. See, there's the back of the skull. There's the front. Now this particular program actually has some nose cartilage here. Kind of want to take that off a little bit, but yeah, there's the sides and everything. So we'll be coming back and forth with this particular program. This is a really cool. This is skeletal. This is visible body. This is their premium skeletal program. Now I'm going to open up. This is posted on your Blackboard page where you would see this video. Skull and vertebrae. This page just happens to be the skull. I will change that. So starting out first of all, so here we have, so I'm going to go down the list. So here's the frontal bone right here. And what you can do is you can rewind this at your heart's content. I'm just going to go through this. I won't go fast, but if you miss something, obviously you can rewind me. So this is the frontal bone, forehead, this whole purple area. I like to use, when I can, the colored skull. I'm also going to use some pictures in these videos as well, just pictures out of a textbook, drawings of a bone, if you will. So I'm going to go down a little further. So see this opening here? That's called the supraorbital foramen / notch. Now sometimes you can see a notch like right there, but a foramen is an opening in a bone. That's where nerves, blood vessels, artery, vein, that's where they exit or enter areas where there's bone tissue. Bone is so dense. Now up here at the top, these are called the superciliary ridges. Think about where the eyebrows are. You can kind of see it there. If you were actually rubbing your finger over that, it'd be raised a little bit. But that's the superciliary ridge. This is the supraorbital foramen. So if you were asked a question, name this bone, it would be a frontal bone. If you're asked to name the structures, this is a supraorbital foramen, and this ridge here would be the superciliary ridge. Okay, I'm going to bounce back and forth in this document. I'm going to go to the next section. These on the side, all this here makes up the roof of the skull, is called the parotid bones. And if you'll notice, I'm going to go past this. There's a drawing past this one. Here's the other side, right there. That's also the parotid bone. And then here's a nice little back view. Those are the parotid bones, and they're separated by, these are called sutures. We'll get to those later. Now I'm going to go back up. I apologize to bounce around. See this blue bone here? If you go on your list, this is the zygomatic bone. And what you have here, so here this whole blue area is the zygomatic bone. This whole thing includes the yellow part, if that's yellow, and this blue area is called the zygomatic arch. That is B under number 3 on your list. Now, this one little piece, this is called the zygomatic bone. If you were asked, though, to name this structure or process, this little part right there, this little, I don't know, 1/2 inch to 1 inch area, that's called the temporal process of the zygomatic bone, because that part of a bone connects here, which connects to the temporal bone on this side. So this arch has 2 parts to it. It's got this initial part here called the temporal process, and it's actually got this part on the back that's part of the temporal bone. This is actually called the zygomatic process. So next, let's go to the temporal bone. So this side here, all of this kind of mustard yellow color is the temporal bone. If I go back up, and you can see it there on the inside as well. This is the skull with the roof off of it. This is the top of the skull. If you take the whole parotid bone, frontal bone area, that's what it looks like. This is the underside of the skull, it's a drawing. But see on the other side? So here we go. Here's all the temporal bone. Now, I'm going to go down the structures. This has the most of all of the skull bones. This has the most parts. So this is the underside of the skull. Do you see this area here? Now here's that arch I was just describing. All right, this is called, this little depression, that little area right there is called the mandibular fossa. It's where the jaw connects to the skull. So if we move up, see that area right there where the jaw is attaching? That little depression where the bone connects, and there's some cartilage there, you just can't see it. There, that's called the mandibular fossa. The external acoustic meatus is that little opening on the side here. It's the actual ear canal. You know, the ear's out here and the actual canal that goes deep inside the skull. That's called the external acoustic meatus. A meatus is a passageway. Now we're back to this arch. This whole thing is called the zygomatic arch. And like I said, this piece here that's part of the zygomatic bone is called the temporal process. Starting right there where the color change is, all the way to the back, this is called the zygomatic process. So just look at it this way. This whole arch has 2 pieces, and this piece is called the temporal process. That piece there is called the zygomatic process. So the whole thing is the arch. It's got 2 parts to it. I'm going to bounce back out. I'm going to click on our skull. And let me see. I didn't notice. I see zygomatic. And maybe I'll click on this. There we go. I'm going to turn it that way. So there's the zygomatic bone. See, there's that arch. See that little, now this is a little bit better. See that section? That's called the temporal process. If you go to the temporal bone, which, there it is. Here we go. All this is the temporal bone. See, that's the other part of that arch right there. Okay. Now, the mastoid process, if you rotate this around, see this bump on the side here? That's called the mastoid process. It's behind the ear. This little part that looks like a tooth that's coming down here and also right there. If you get a little closer, I'm going to click on the, see that? This little area coming down, that's called the styloid process. And it's just a part where it's a little point where ligaments attach. That bump in the back is the mastoid process. So if we go back, there's the mastoid process, and you can barely see there a styloid process. So if we go back up to this drawing, excuse me, down. So there's the mastoid, and then see the little pointy thing coming down, that's the styloid process. Now, the last of these is kind of hard to see. If you take the lid of the skull off, so this is the top of the skull, but the lid is taken off. The roof of the skull is taken off. This is the interior skull. You can barely see there. There's a little opening on the inside of this ridge. And that's called the internal acoustic meatus. Things like that would be a great bonus question for you. And we're talking about that little hole right there. A meatus is a passageway. This is the inner ear cavity. The external acoustic meatus, like I showed you, is there. It's on the outside. Okay, the occipital bone. It's this area in the back. It's where the bad guys or good guys hit either one to knock them out. See this blue bone on this particular drawing? This whole back part of the skull is the occipital bone. I have a better picture. Say, I'm sorry to bounce around. I have to do it this way. So right there, see this green? That is the occipital bone. Now there's a couple of parts you have to know about this. There is a bump down here. Everybody has this in the back of the head. And it's really good here. See this bump? That's called the occipital protuberance. It's letter C under number 5 on your list. These two structures on the side, these are called the occipital condyles or smooth occipital condyles. This is where the first vertebrae connects to the skull. So the skull sits on top of the vertebrae on those two structures. So it's called a condyle because that's generally where you have two bones coming together. And this big giant opening is called the foramen magnum. It's where the spinal cord exits the skull. So if you go back up here, yeah, I believe it's this way. I'm wrong. I'm sorry. I don't mean to bounce back and forth. All right, here we go. See that? So this whole thing in the back here. Now this is with the lid off. Like I said, this is the middle part of the skull. The top of the roof is gone. But you can see the foramen magnum right there. On the other side of that, the skull would look like this. This is the underside of the skull. And so these are the condyles. So this is underneath. This is the posterior underside of the skull. This is the top of the skull with the lid taken off. Now, the next bone is called the sphenoid bone. So see this green bone that goes around this way? And yes, you can generally see this bone from all different areas of the skull. You can see it, have a difficult that way, but see that green area there? That's the side view of the sphenoid bone. You can see it here. Here are the wings in the front of the skull. But there's a couple things you got to know. And here's the best way to look at it would be with the lid off. So this view right here looks like the Batman signal or Batman symbol. Okay, these down here are called the greater wings. And then these up here, these look like little ridges or little handlebars, are called the lesser wings. And then this part sticking up, there's actually a depression here. This is where the pituitary gland goes. But this whole piece in the middle with this sticking up is called the sella turcica. So, and I would say, yeah, this ridge, including that whole little area in the middle, is called the sella turcica. These are the lesser wings of the sphenoid bone. And then these flaps here, including with the holes, we don't do the holes, those are the greater wings, excuse me. These are the greater wings. These are the lesser wings. The next bone is called the ethmoid bone. Now, it is also a bone. I'm going to go this way. It's this yellow bone. You can see it here. You can see a piece of it there. This is actually called the perpendicular plate. This is called the perpendicular plate. And then there you can see it that way. Now, what you do is you kind of scroll down. You have to look at it with the lid off this way. So this is also the ethmoid bone, and this is something called the cribriform plate. So let me scroll back up, and I apologize for jumping back and forth. So I'm going to go back up here. So see this area in the middle? That is the perpendicular plate. It's the part that separates the nose into left and right halves. It's 3/4 of this whole thing. This on the bottom is actually called the vomer bone, but it's a different bone. But that yellow area, that's the perpendicular plate. Now, I'm going to go down to the view where it has the lid off. So, this way. This is called the cribriform plate. It says look inside the skull. You have to take the lid off. There's a little point that sticks up, and if you could run your finger over it, it would be kind of sharp. Not sharp, but it sticks up here. That's called the crista galli. And it's not on your list, but those little bumpy, look like almost holes, which they are, those are called the olfactory foramen. This is where the nerves for smell go into the nose from that area. So, but here's the crista galli. This whole outline here would be the cribriform plate. And one more time, and it's all part of the ethmoid bone. That piece there is called the perpendicular plate. It's part of the ethmoid bone. Now the nasal bones, pretty easy. See this purple right across that way? It goes, I'll just outline, oops, I'll outline it. I clicked on it, I didn't mean to. That's the nasal bones. They're kind of separated. If a person breaks their nose, they break that. This area here is called the maxilla. All of this, what is that, kind of burnt orange looking bone here? There is something here. Now see this hole underneath? This is called the infraorbital foramen. A foramen is an opening. And then the area here that the teeth are attached to is called the alveolar process. So those would actually be the sockets that the teeth sit in. So it would be like this area in here that the teeth are sitting in. Now, if you go on the underside of the skull, I know this is a different color, but all of this is the maxilla. See the teeth? See this area here that makes up the roof of the mouth? 3/4 of the roof of the mouth? That's called the Palatine Process of the maxilla bone. If I go back and you click on the skull, you can actually click on this part that's called the hard palate, which if you rotate it that way, see right there, that would be the maxilla bone. This is called the Palatine Process. Let me look at one more view. Lacrimal lower arch, sagittal skull. Yeah, and then we'll do it this way. So here, if you rotate this around, and you kind of can, I didn't mean to do it that way, but so here's the sphenoid, you can see it, and then see this up here, that's the cribriform plate. Let me get a little closer. Oop, a little sensitive. Anyway, it's right there. And see, yeah, those are supposed to be openings, but if I turn this here, see that sticking up? Okay, that is the crista galli, and then there's the little foramen I was talking about, and that whole piece there is called the cribriform plate. So it's part of the ethmoid bone. I didn't mean to jump back, but I was trying to find part of the maxilla. So let me do this. There we go. Okay. Now, I'm going to skip down one. Well, no, we'll come back. We'll come back to this. Next on our list is the mandible. See, we're almost done with the skull. It says upper arch, lower arch. Let me click on that. Here we go. Great picture. I'm going to rotate it slightly. Here's the mandible. So lower, basically the jaw. There we go. Let me make it just a little bigger. All right, see that? Now, there's a couple of things on this. On the mandible, first thing, if you rotate it this way, see this hole here? That's called the mental foramen. And then when you turn it this way, you can see in the back, There's kind of a smooth area here. This is called the condyloid process. This thing that looks like a shark fin coming up is the coronoid process. So that's C. Here are the alveolar processes where the teeth sit in, and you have to turn around this way in the back. You can barely see it here, and you can see it there. That's the mandibular foramen. So that, like I said, a foramen is where blood vessels and nerves will exit. So I'm going to go down just to review you on the real pictures. I have to go all the way down, I apologize. So there's the mandible, there's the mental foramen, here's the condyloid process, here's the coronoid process. And let me go down a little further. Oops, I didn't mean to bring that up. And then, so here's the front of the mandible. So there's the mental foramen. Here's the coronoid process. This across here would be the alveolar process. And then in the back, see that opening? You can't hardly see it. That's the mandibular foramen. And this is not the greatest picture. This is like a view if you're looking down on top of it. Here's the coronoid process, and there, excuse me, the condyloid process. There's the coronoid process. All right, I'm going to go back up. The lacrimal bones, and I did that kind of quickly. You have to look on the inside of the eye cavity. So see these pink bones there and there? Those are the lacrimal bones. If we go back to our skull, and probably could do this. It says nasal cartilage. I don't see it, but that's okay. So it would be like that little bone on the inside right there. Those are the lacrimal bones. The vomer, what you have to do on your skull is turn it upside down like this. Ooh, this is kind of crazy. And this is the hyoid bone that's dangling beneath there. See, it's not actually attached. I'm going to go back. The vomer, you have to turn the skull over this. So see this blue bone here? That's actually the vomer bone. It's the bottom part of the nasal cavity. And while I have this up, if you look on your list under 14, see this red area? Those are the palatine bones. See, they're separated. There's actually two of those. This was the palatine process of the maxilla. This is the palatine bone. The only thing left on our list here, and I got to show you a couple other things, but they're called the inferior nasal conchae bones. So it's number 13 on your list. You can see them here. They're scroll shaped. There's some up here that aren't on our list. They give the nose some surface area, but those are called the conchae bones, this part. Okay, one last thing. We're going to do the sutures. So I'm going to try to go in order. So going here, see this suture that goes, a suture is a joint, but it's what's left of what are called the fontanelles. But see that little squiggly looking line that goes across there? I want to make this a little bigger. See that? That is the coronal suture. It goes in the same plane as the frontal coronal plane. Now, if I go down a little more, so while I have this view up, there's actually a suture that goes all along where the temporal is, and it's called the squamosal suture. It's number 19 on your list. So it's all of this. Now, the sagittal suture goes right down the middle. This one, see this squiggly line? That's a sagittal suture. And then this one that goes across the back where the occipital is called the lambdoidal suture. That's number 18. Sutures are what are left of the fontanelles, which are unossified parts of a baby's skull. So moving on to that, if you move down here, we actually have some baby skull pictures. So here's an infant skull. Let me make that a little smaller for you. I'm sorry if it's kind of blurry. This is actually a baby skull. It's about the size of your hand. It's not very big. See that area right there? That's a soft spot. That's called the anterior fontanelle. Fontanelles are parts of bone that are not ossified. They're still tissue. They allow the brain to grow. So the big one in the front is called the anterior. This one that's marked in the back with the dark spot is called the posterior fontanelle. So they're parts of the bone that are not solid. They're not ossified yet. There's the posterior fontanelle. Couple of side views. Here's a baby skull on the side. This is actually called the sphenoidal or anterior lateral fontanelle. This dark area in the back is the posterior lateral or mastoid fontanelle. So there's 4 of those. Posterior, anterior, or posterior lateral, anterior lateral. Either term works. If you put mastoid or sphenoid, that's fine too for the fontanelles. Here's the posterior fontanelle, and then up here would be the anterior fontanelle. And that is all of these skull parts. So go to the next video and watch the one for vertebrae.